Welcome to Let's Get Political San Francisco. I am your host today, Eva Kane, and in this studio we have Ilyich, also known as Equipto, from the Frisco 5 hunger strike. And we also have Rupa Marya, medical director and professor at UCSF of medicine. Welcome. Thank you both for being here today. Very excited to dive into our topic. It's a big one. So, police gun violence and the gun epidemic as a public health issue. Not only are we suffering from these issues in our city, but we're in a crisis on a national level. Recently, 2 local movements were started in our community to reframe the dialogue. What are both of your reasons for advocating for this issue and starting such imperative movements? Please tell us about what you're fighting for.
Wow. I mean, for me, I think it's beyond just the gun violence and, like we say, even the tasers. It goes beyond. It's the screening and the training and everything that's going on in these police departments, and specifically the San Francisco Police Department, which I'm trying to figure out what's going on in there. So I mean, it's something that's been going on, and I think the difference has been maybe, like you said, the videos, and now you got social media. There's different platforms to show these murders and these executions that's been going on. So it's been going on, and I think me personally, it's just enough is enough kind of attitude. Being born and raised in this city and having not just police violence, just violence period in my city. I've had best friends die from gun violence, and so it's affecting my family, my friends, and everything that I'm trying to be a part of, and I think of the generations to come, as far as my nieces and my nephew, my godchildren. And I'm, so that's what I'm fighting for. That's kind of what I'm in this for, as far as trying to let it be known what's going on in San Francisco, putting it in people's faces, and just to keep fighting, because I know it's never, not never, but I mean, it's an ongoing struggle that we're going to keep fighting. Because I mean, a lot of us, there's so many opinions and theories that we have where people don't want police armed, or people don't even want police. You see, there's abolitionists, there's all type of different angles that we have to consider, to like reform and help our people. You know what I mean? That's going through mental trauma and all the things, to try to function as a society. So I mean, that's pretty much kind of what I'm in it for, is just our future generations and what's going on in San Francisco and around the world.
Thank you for that. Appreciate it. Now for you.
I echo your sentiments. I also feel like what we're witnessing here in San Francisco is a microcosm of what's happening around the world. It is this kinds of violence. It's also economic violence that we're witnessing, which seems to be underpinning all the violence that's lying on top, and it's very specifically targeting people of color, people of lower socioeconomic strata, people with mental illness. So these folks who have lived here and established communities here, who are being marginalized as San Francisco in this area becomes once again the global seat of hyper-capitalist capital. So the what we're witnessing right now is, a similar kind of destruction that's happening around the world, but it's happening in a very focused way in this very tiny geographical space. So for myself as a physician, just to clarify, I'm not a medical director at UCSF. I'm a doctor. I'm a physician and a professor of medicine there. I have just been deeply sad watching people I've known be shot by the police, sad watching people I know get evicted, elderly people who've lived in their homes for 50 years become evicted, and you watch them unravel in the hospital because what has held their lives together has been their communities, their connections, and when you take elderly out of that, it's really a death sentence. So to watch this kind of violence, and it's happening on all these different levels, I feel it underneath it all is an economic kind of violence, to which we have very little protection against. So when I saw, the Frisco Five doing this hunger strike, I had been so deeply affected by the shooting of Alex Nieto, Amilcar Perez Lopez, Charles Hill back on the BART several years ago, who was someone I had cared for personally. That when I saw people were willing to put their lives on the line like the Frisco Five did, I felt it was imperative to step up and make sure that they were safe.
So you actually tell us the story about how you met. So you didn't know each other before the actual hunger strike, correct?
No.
Basically, we met maybe the 10th day or the 8th day into the hunger strike. I'm sure she knows too, or somewhere around there. But I mean, a lot of things are still blurry to me. I'm gonna be honest. It's not like too much pinpointed on, and I don't remember exactly. But I remember us going to the clinic and us being in a circle inside and talking, and just and just the genuine care, like that came up to us. And it started a great like bond and a friendship, and trust, because I don't, not everyone trusts doctors. You don't trust mechanics, so you're not brought up to trust people that can't, that are just, they're not gonna fix it. They're just paid to, keep you buying medicine or keep you coming back, get your car fixed and stuff like that. Those are my analogies I bring into it. So I was skeptical in a sense, and just, but I was willing to hear anybody's advice at that point, because it got longer than we thought it was going to be, and we just kept going. And as she explained it to us, as far as being in a euphoric or some type of mind state, you know what I'm saying, where you think everything is like, no, I could last, I could do this. It made total sense to me of how I was thinking. I was like, wow, because you go through a certain, I think, transition in there where you almost feel like invincible and you're ready to give it all up for whatever the cause you're doing it for. And so she brought that to my attention, and certain things just as far as our health period, it was good to hear. And, after a while, like you said, she was saying, like, she would text us and bother us, but in a good way, bothering us because she knew that we would be lazy about certain things, that we would overlook some messages or just keep going. And like she said, we think that we could take on the world, So, I definitely give it up to her and all the students and everybody that was there that was just gave up their time. And, no one got paid. No one was doing anything. Everyone was just, I think, on the same page as far as what our goal was for getting Sir out or Ed Lee out. And most importantly, our health and us getting out of there, healthy. So, but yeah, it started a great bond within the whole community, right. But it was special for that too, for us to go there and everybody, take heed and understand that it was becoming a serious issue,
One of the great privileges about being a doctor in San Francisco, when I used to live in San Francisco before my rent was increased by $2,500 in 1 month and I had to leave. One of the great things about living and being here is that you get to see your patients on the street and develop long-term relationships with people. I mean, I could tell when my patients weren't taking their thyroid medication just by watching them across the street. And so you could go up to people and say, hey man, what's going on? What help do you need? Tell me what's happening. And so you can develop really personal relationships. As a practicing physician, it's extremely valuable to have that kind of contact with people. And so when I saw them there in front of the Mission Police Department, I saw them on day 3 or 4, and then I said, okay, well, I'm going to come back here again on day 7, 8, and if they're still here, I'm going to go in there and introduce myself. And so I was like, oh God, they're still there. So then I went in and found out, who was there and how old they were, and I was most worried about Equipto's mother, Maria. And so that experience, I think, was really profound because it shows the beauty of what San Francisco has been, which is people reaching out to people they might not know. I ended up knowing Selassie from a show that I had done a few years before. So there was this connection as artists and people who've been active in social movements from different angles. And so we invited them to our free clinic, the Clínica Martín Baró on 24th and Balmy, which we've been hosting since 2007. So it's geared towards undocumented migrants, so people can come in and get free and anonymous health care. And it's a run by San Francisco State Ethnic Studies group and UCSF medical students. And so I've been a faculty preceptor there since 2007, and it's been a wonderful place to teach about the upstream causes of disease, to teach the medical students how to think about disease in a much more lateral, broader way than they're traditionally taught in medical school, and to interact with college students who might be interested in getting involved in health advocacy, public health, or becoming a doctor or nurse or practitioner. So we invited them to the Clínica, and they came, and I've never seen so many students there. So usually, we have maybe like 6 or 7, 7 to 10, and they were like 20 students. They were so excited that the Frisco 5 was coming, and in their digestion of what this experience, all of them said, this is why I became a doctor. This is why I wanted to go into medicine. This is like, I want to be caring for people involved in social movement. I want to be accompanying people through social struggle. And that was sort of the impetus to coalesce our work together more formally in a campus-wide coalition, the Do No Harm Coalition, where we decided, okay, let's take on the issue of police violence as police violence and racism as public health issues here in our city and then nationally, and hopefully inspire more physicians and healthcare providers to become advocates, outward advocates, and accompany people in their communities around these issues. So that is what we are actively trying to do and continuing to do. But then it's opening the dialogue to other issues like the economic violence that we're witnessing, the evictions, the fires in the mission, all these things that are happening in front of our faces that are directly impacting public health and safety. And not just public health in terms of people's bodies, but the health of the public, the body politic, how people are feeling safe and secure in their city and governed, how they're feeling safety by the governance that's in place. And that safety has very much eroded in San Francisco for longtime residents, and that's extremely concerning.
Extremely concerning, and that was beautifully said. And right now we're going to take you to a clip from a recent protest at City Hall with the Do No Harm action. Wow, so powerful. That's the hashtag do no harm hashtag, right? So if we want to direct anybody or anybody that does work in the medical field that they do want to help and join in any way, how can we direct them to do that?
They can look up our website, Do No Harm Coalition, and we're based at UCSF, but we would love it if more doctors and medical students start their own chapters around the globe, but specifically in the U.S. to address police violence and gun violence, or any sort of economic violence that's underlying what we're witnessing.
Absolutely.
So we're still, in our infancy as a group defining, and the medical students you see up there and the young doctors are so busy with their training. So we're still, defining and crystallizing how we're going to get involved and coming up with initiatives, things that we can do now that are mass push. We had 17 days of action that was in honor of the Frisco 5 17 days of hunger strike. So now we're crystallizing what's next and how we can become more effective advocates for the change we need to see.
I can't wait to see what you guys have next under your sleeve. And I would just have a question for you, Equipto. So dubbed the Frisco 5. Are you still the Frisco 5 or the 500?
Right. I think Frisco 5 is like a moment in history almost, is how I see it. It takes, a little bit more than 5 to get things going,
Absolutely.
So, I mean, it all happened in the Frisco 500, 5 to the 500. I think it happened as our transition to the hospital, and how everything just became like it became at a level where, the community and, like you said, Rupa and everybody came to rescue us because it wasn't looking good. It was getting worse. It was, and the Frisco 500 came about through the hunger strike, through an action at City Hall, to get people motivated and understand the urgency of what was going on as far as us being in a hospital. I mean, people were reacting, because we all were uncertain of what was going to happen. Whether it was permanent damage or who knows, what was going to happen. And I think the community just reacted and got together and said, we're not going to have it. We need Chief Sir fired. Our friends are in the hospital. Our people are in the hospital, and we need to make something happen. So, I mean, I consider myself a Frisco 500 member and a strong supporter of them too, because it's eventually we wanted to grow to Frisco 5,000 to 50,000, and it's not just like a Frisco thing. It's not like you have to be a native or anything or a longtime resident at that. I'm going on tour, and I'm planning to bridge out and have some Frisco 500 members in New Mexico and Arizona and Wyoming, and get the natives involved and things like that, because it's 500 it's just, I think, the 5, like, it's a moment of history to get Sir and Lee out, and the 500 just expanded to something more. Maybe it was like we could deal with these fires that's going on in San Francisco. And like she said, it's all connected. It's all connected.
I think that was so powerful for me about that. The whole experience has been, there's so many activists and people in our community who are slogging away at this issue of community safety and violence, and police violence specifically in the community. People working for Mario Woods, people working for Amilcar Perez Lopez, Alex Nieto, and we need all these different groups working. And what was so beautiful with what happened during the hunger strike was to watch this coalescence of all this energy of people together. Absolutely. And I think that the more we can keep that in our minds, that spirit and that potency, the better, because we are each doing an important piece of the work. And there's, no one is doing the whole thing. And so Absolutely. I think that it's really a beautiful demonstration of how collectively we are stronger, and the more organized we can be, the better.
Absolutely. Absolutely. So I'm going to ask you both a question. Given the recent tragedy in Orlando, would you like to comment on handguns, assault rifles, and access, and public health?
it's hard for me sometimes to understand what's going on because I don't like believing anything that I look at, and as far as news and things like that, and what was portrayed, and because I've seen so many things. I've seen actors and people in certain tragedies, and it's just, so I'm always like looking at both ends, and I'm always trying to be as respectful as I can to the situation. But I mean, yeah, I mean, guns is like, I don't even know what to start at, because gun violence is something that that's obviously a huge problem in America. Period. You go around the world, and it's not, or at least in Europe, in certain areas, like policemen don't even have guns. And so obviously their crime rate is not as increasing as America is, or what's not. So I mean, I think we could always go down to security issues and how we got to go by, but then that just brings out more police and more military and stuff like that. You know what I'm saying? So you see how Black Lives Matter pulled out of the the Pride Walk and all. It's just so it's a real like messy situation in a sense. To me, because I'm like, in my opinion, I'll say it. I'm not against guns. When it comes to protecting my people and protecting my family and eventually, I don't like the police. I don't trust none of them. I'm not gonna call the police when my house is getting robbed, or when people are trying to enter my house unlawfully or anything. So to me, it's a rough situation. I'm gonna be honest, because I'm not with the police, but I'm not with lunatics having pistols either. I don't like it. And it's a tough situation, and it's the world we live in right now.
We can look at what happened with tobacco, the history of tobacco, the tobacco lobby's grip on the science, the data, and the health of people's lives in the U.S. And as the last 50 years have progressed, and we've seen more populist control over tobacco, let's say, where people's lives were finally put in before the tobacco lobby, and that took a lot of time, a lot of lawsuits, a lot of effort to wrest the power away from the tobacco lobby into the hands of public health. And once that was done, and we had these smoking bans that have been instituted throughout places, but specifically in California, you saw rates of fatal heart attacks, fatal strokes, ER admissions for respiratory and cardiac diseases go down significantly, like more significantly than any drug that's been developed in the last 30 years or any procedure that's been developed. Right. So it's having a striking effect on the public health of people. And that effect was delayed simply because of the tobacco lobby, which is criminal. And so I think the same thing with the gun lobby, the NRA and the gun lobby. I respect people's desire to want to protect themselves and their families. I don't think that's what's at issue right now. I don't think people need assault rifles to protect their families. And I don't think people who've been on terrorist watch lists or, found guilty of domestic violence deserve the right to go buy an assault rifle. So I think there's a real political struggle that has to be really fought as hard as possible. And I was glad to see the American Medical Association finally stepping up and stepping into what the National Physicians Alliance have been asking for years, which is to request that federal funds can be used to study gun violence, because this is an epidemic.
And what keeps you both so unique, that you're both fighting the same fight, as well as you're both musicians. So both, how do you use your music as a catalyst for social justice?
I throw shows and I do things for the youngsters out here in San Francisco and the Bay Area, and try to give them a platform where they don't have to rely on a promoter or quote unquote, someone that's, trying to make money off of them. I'll throw a show and give them all the money and not make, just get my flyer money back, just to show them, to get a taste of what's going on. So I think that's kind of what I'm more into. I mean, I have tons of music that's in the studio that'll never get released or might get released. I'm personally not in this type to sell myself and try to be like, hey, listen to my music, because my music is definitely not revolutionary like that in my world. It's very personal. My music is more personal, and it might consist of, some politics and compassion and community, but it's something that I kind of, is sacred to me too, and So it's not something that I'm like, yeah, this is coming out. Check the new revolution.
Right.
You know, it's
Right.
just something that comes genuinely, naturally.
Right.
It's my air, you know.
Right.
So when it comes out, it comes out. But my
Right.
focus more is on youth, you know, music, arts, and culture out here,
Right.
and giving them a platform.
We'll be looking for you. And then Rupa, I want to hear.
Well, so for me, I've had
Refiguring.
music has definitely taken a back seat. I was actually texting with Equipto about this recently. I used to play at the Independent yearly. We've been selling out that venue for 7 years straight, and I have not been able to bring myself to play in San Francisco since the death of Alex Nieto, and how it's been handled by the city, and my lack of faith in what I'm watching going on, and the slow destruction and erosion of my community, our communities in this area. It's been really hard to want to play in San Francisco. And it's been really hard to find a voice for my rage right now. And I don't find I write the best when I'm pissed off. I find I write the best when I can like elevate my mind to see a little bit further down the line and give something hopeful to myself in my music. For me, music is very much my own medicine. It helps me feel uplifted as I'm participating in these struggles. And right now I'm having trouble feeling that resilience. I am participating on a very large-scale project with Indigenous women up in Vancouver who've called me to collaborate on some stuff, which will take me up and down the coast with different Indigenous groups. So that's where my compositional mind is going right now. And then I'll be touring with my band in Europe in August.
I just feel blessed personally because I've been able to do music since I was a kid, and for me to be like, a lot of my friends haven't, a lot of people that I know haven't, so that's kind of why I do it like that. I feel content in a sense of, and blessed for the places I've gotten to go with my music. So that's kind of why I feel like I've done a lot, and I feel fortunate. So it's kind of like, you know, the next has to do it. You know?
Right. Absolutely. I think it's beautiful that you both are so talented on both sides, and thank you so much for taking the time today to discuss this with us, because it's a big issue that needs to be addressed and we need to talk about it as much as possible. Thank you for tuning in to Let's Get Political San Francisco, and if you haven't liked us on our Facebook, please find us, Let's Get Political SF.